call the meeting to order. I'll ask Amy if you can call the roll, please.
Dr. Jones?
Here.
David, please. Kathleen Young? Here. Dr. Reichstack? Dr. Vera Weiss? Dr. Peterson?
Here.
Dr. Goodwin?
Present.
Mike Ingram?
Here.
And Dr. Dick?
Thank you. Our next item on the agenda is the approval of the agenda. I would like to propose one addendum to the agenda with item L next meeting, if we could add change meeting date. There will be some conflicts on that date of November 14th, so I just like to add that so we can have a discussion about changing the meeting date.
Second.
Moved and seconded, all those in favor of the addendum?
Aye.
Now go back to the agenda. Any additional addendums? Hearing none, all those in favor of approving the agenda?
Aye.
Aye. Anyone opposed or any abstentions? Thank you. Next, I'll move with approval of the minutes from the meeting on Tuesday, June 13th. That was rescheduled from June 20th.
So moved.
Okay, move to approve the minutes. Do I have a second?
Second.
Second by Linda. Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. Do we have any public participation on our agenda items? Okay, moving forward to correspondence and communication. Anything, Julie? Thank you. That takes us to other business, discussion of the proposed County Board of Health budget. And we have Tammy Ogden here from the county to answer any questions you might have about the budget and talk about what's been in your packets in terms of talking about our fund balance and reserves and line items. This year, as I understand it, Kathy will be presenting this to the county board on the 29th. Tammy, you are kind of stepping away from that role, is that my understanding from this
I'll
meeting?
be there,
Okay.
but yeah, I won't actually be presenting the budgets other than the ones that are my purview. So I will send a slide that we'll have up in advance, so you'll have an opportunity to look at it. But will all three of you be at the meeting?
Yep, that's
Will
my
you be there?
intention.
Yeah.
Okay, I'll put all of your names on it.
I think it's next week.
It's next Tuesday.
Right, Mike?
You are on Tuesday night, I believe.
We are. Can I ask for some clarification on that? Help me, well, maybe we can do this separately, but last year we said Kathy will be responsible for presenting, with you presenting, but I'm trying to make sure I know what that means for sure. Maybe we should do this as a conversation following this meeting, but I want.
Well, I can't stay for the whole meeting because I have another meeting on the other side of the
Well, I
county.
can even do it in a phone call maybe. I just want to
Yeah.
make sure I'm prepared, because last year I was prepared, but honestly, we didn't do anything.
Yeah, this year you will. And so I would say, wait till I hope to work on the slides tomorrow afternoon. So
Okay.
I'll send you a copy of the slide that I plan to put up. If anybody has changes to it, you can let me know. But essentially you'll be talking about, your revenues and expenditures, if there are any significant changes, which of course, the grant funding is kind of fizzling out, so you can talk about that. And you would talk about the additional projects pending tonight's approval that the Board of Health may want to engage in budgeting from fund balance. Those would be the kinds of things that you could bring up.
You might really depend heavily on Julie
Yeah.
to do that.
Yeah. Well, that's what I'm kind of trying to clarify.
Yeah. Julie does a very good job of.
Yeah, last time I don't think that they had any questions, but we'll be ready if they,
They
if
did,
we do, hopefully we'll know.
the expectation is that I'll go through those slides, is that right?
Yeah,
correct.
okay. So I will say, I did send an email yesterday afternoon to the elected officials and department heads, directly tied to the county, and asked that They just focus on high level, you know, bird's eye view, hit on some highlights, either revenue or expenditure or both, additional things that are added to the budget, and, you know, if the board doesn't have any questions, they don't have any questions. But because we have everyone presenting their own budgets, we want to make sure we're moving along and not getting too far into the minutia.
And I want to point out on the documents you have in your packets, and I know some of you have those digitally as well, that we have 4 presentations that are going to happen for requests for funds. And so right now those are built in, but we need to talk about each one of those individually and make a determination on whether or not we want to actually fund each of those projects, because you know, you can see there is a significant decline in the fund balance currently, and as you know, we use the fund balance as a means for any type of emergencies that may occur. We were very fortunate in this last emergency with COVID and the pandemic that there were funds made available from the federal government that covered a lot of our costs, but we don't know what might happen in the county independently or in the state independently, in which federal funding would not be available, nor would state funding be available potentially for those types of issues or concerns. So I do know that that was shared with me, and Mandy can speak about that as well as Julie. So I just wanted to point that out, that everything is in, but nothing has been voted on at this point. This is just to give an idea, should everything be funded, what those numbers would actually look like, so that we can make decisions on how we want to move forward. And I know we only have Tammy here for
I could stay till probably another half hour at least.
So would it be your pleasure to move forward with those discussions with Tammy here and try to go through those so that we have an idea of what we need to send back to her? Because if this needs to be updated or changed, we'll need to make sure that she knows that. And if we're not done, then I will send you an email, make sure you're aware, just like we did last year. But yeah, if anything's going to come out, then we need to make sure that that's updated before next week.
Can we have an update from Tammy on the fund balance first?
Yes, please.
I think you need that.
Yeah, so and you have the fund balance numbers in front of you. For the 2024 budget, as Krista indicated, currently there are several projects that are budgeted that haven't yet been approved, but those projects at this time are built into the budget. So that would reflect a $115,000 draw on your fund balance if you were to spend every penny towards those projects. So we know you probably, hopefully won't spend the $15,000 for emergencies, but assuming that you would spend, you know, the whole $115,000, that $340,824 fund balance is representative of a 26% fund balance. I know that, you know, several, if not all of you, are aware that there are pending property tax cases related to the hospitals. There was a recent ruling on one of those, and if that ruling stands, then there will have to be a pretty immediate payment for the 2004 taxes. There are 2 other outstanding cases, Carl 2 and Presence, and you know, if there were unfavorable rulings in those cases, I'm assuming that you would want to have some kind of idea of what the potential liability would be for payment in all of those.
That wasn't escrowed then?
No. This would come from fund balance. So I don't have hard numbers for you, but I did talk through yesterday with our state's attorney's office, and what I can tell you is that we do not believe that it would be any more than what you paid for the Carl 1 case. And that was $54,388. We believe it will be less than that, not including potential prejudgment interest. So if prejudgment interest were to be awarded, I have no way to tell you what that number would look like.
I thought that in this, it was not awarded.
In the first case, it wasn't. The one that you've already paid, it wasn't. In this particular case, I don't think it was, but if it is appealed, then there's that risk, right? So, I can't give you that number. I will also just, I feel like I need to say that, when we calculate what that looks like in terms of which of the county funds are going to pay which portions of the liability, it's based on the rate. So I didn't go back and I just used the rate that we had at the time that we were paying Carl One, which your rate has been pretty level. Some of our other levies have had, you know, allocations that have gone back and forth between them, so there have been deviations, but the Board of Health's rate has been fairly level. What you should know is that, you know, with the levy, health levy, we collect that levy and then we turn around and redistribute a portion of that back to CUPHD. So I know with the first ruling, the entire amount just came from Board of Health fund balance. It's possible if the Board of Health said, hey, listen, this isn't all of our money, you know, part of this levy is a pass-through, then there may be a conversation with CUPHD about this portion of the liability is, you know, actually belongs to CUPHD as opposed to Board of Health. That's kind of outside of the scope of my, you know, purview. At the end of the day, the county's got to pay back because the county's levying, but then there's the additional pass-through that also could be considered as, you know, partially CUPHD responsibility. That would be something that Board of Health would have to work out with CUPHD if you wanted to do that. Now, I'm assuming at this point that, you know, the whole amount would come from fund balance. It would be no more than what was paid last time. If, in all three cases, and by the way, the other two cases probably wouldn't happen anytime soon. So we're talking about, you know, down the road. So there's just a lot of variables here. But let's say, you know, there was a unfavorable ruling in all three cases and it happened in 2024. You spent your $115,000 from your fund balance and you had to pay out another $54,000 for this ruling. That would bring down your fund balance to $286,000, which is 21%. Are all of those things likely to happen in 2024? No.
Because if it's appealed, everything's on hold again.
Exactly.
So, and I believe it will be, probably.
I don't think that has been determined.
Several attorneys have made a career out of this, haven't they? Yeah.
And the fund balance is currently at 26% of
It's, if everything is funded, it would be 26%. It was at 34% at the end of the last fiscal year. So if we fund all of those projects, that takes it from 34 to 26.
If you fund all of the projects and then pay out the full amount, yeah.
And then
No, I thought if we paid out the full amount, it
then
takes
it goes
it
to
to 21.
No, the full
No.
amount of the projects.
Oh,
The
yeah,
full
yeah,
amount of the
yeah.
$115,000.
She's saying if we had to end up paying the Carl stuff back right now,
Then it would
then it would
be,
go under, and all those things.
yeah,
Yeah.
then it would.
Now, the full amount that we pay out, that includes the 15 that we're just sequestering,
Correct.
right?
That's the
Which
word.
we're
Which
not,
I don't think we've
not
ever had to
likely to
use
spend.
except for like $1,000 of it for some kind of weird outbreak thing. I don't know.
We had to do it for a TB, probably one time on a TB case. or
Was it
something.
TV? It's been under a couple thousand. It's never gone. Or was it an environmental health thing actually? You had some kind of a weird sewer thing, I think. Blame me, age.
Of course, don't remember it. Any other questions for Tammy in regards to the fund balance?
Just, I'm trying to recall, we had some discussion on the fund balance and we were trying to hit a mark and keep it there. What was that number?
So we originally discussed a minimum of being 25%. However, at our previous discussions, because we were, you know, in those 30s and we kind of, you know, Mandy did a presentation, we talked about, you know, that there's recommendations of anywhere from 25 to 37 to 38%, and some were, I believe, 50% even of their fund balance. So when we had that conversation, we discussed keeping it at around the 35%. Was where everyone kind of felt comfortable in this group.
Yeah.
So, you know, this, you know, funding all these projects would dip down, but at minimum, you know, our minimum, you know, base in the past has been 25 at minimum, Julie, do you want to talk about anything else historical about that?
No, I think that what we've done at CUPHD, didn't we change it to 25 to 50? Yeah. So ours is, you know, it's bigger, but I'm comfortable. When I wasn't comfortable was when the board, as Dr. Peterson remembers, used to spend it down to nothing.
Yeah.
I was never comfortable with that. I used to panic. But as long as you've got 25 or so at least put back, then, you know, because you can use something else.
Well, I think we actually voted 25, didn't we?
Oh, we
I
voted
think
35.
25 and
35.
Oh, we voted
35, that's not right,
Yeah.
we voted something higher.
Yeah.
And so if we are saying we're gonna drop below that, we need at least a really good project, because it would, I mean, our concern was you have another COVID type event, and you have all these funds that you really need to have, you know, that'd be something to sort of consider, so.
Yeah, it's really, I see the money, I can see an emergency being like a, more of a localized, you know, outbreak or something, like in the county. We've had one in the past with
With grant.
Lincoln's Challenge,
Yeah.
Rain Tool, and things like that, where it just takes a tremendous amount of staff and
Sure.
time to go. But if it's, hopefully, we won't have another big thing really anytime soon, but if we do, then hopefully the same thing will happen and there'll be federal money coming.
Like a pandemic type.
Yeah, something really big, but the localized ones are harder to deal with, because there is no money coming from those usually
Right.
for those.
And is the only way the fund balance increases, how to say increase?
Saving.
Don't spend money.
When we don't
Yeah.
spend everything, you know,
I
it's
didn't know if
like,
there were investments. if it was
I always
put
like to
someplace.
pretend it's a savings account, because I have to simplify things like that, but to me, it's like you've got the checking account and then the savings account, so anything that we don't spend goes in the,
But we never don't spend.
yeah,
Yeah.
yeah, I mean, there's money that goes
Yeah,
in there,
yeah.
right? It's
Yeah,
still going in there.
I mean-
Not so much, because our budget is way more realistic now than it used to be.
So the
Oh.
interest earnings are quite a bit stronger now
Yeah.
than they have been, not just because interest rates are higher, but also because the treasurer's office is using an outside investment firm. So there have been, you know, you can see here, 2023 projected interest earnings. I'd have to look. I don't know if I brought
So they are
mine.
invested.
Yes, they've been using an outside firm for investment. So I have of that under miscellaneous revenue, that 11,500, 10,000 of that is investment interest, which is, you know, higher than I think this, since I've been here, that this fund has ever seen. The other thing about fund balance is, you know, presently this document says a fund balance of 25% of expenditure budget has been established. Do I need to update that to 35%?
We voted on it
Okay.
around this time last
Yeah,
year
I
to
don't
keep it
remember
at
what it was, it just when we
35.
did it, they were
Okay.
allowed to have a little higher. That
I
was
can
our
make
thing.
that change.
Yeah.
I think.
Actually, it wouldn't be bad politically to come in with that 35 because of we've had folks that said that's too much, and here we are below our target. So that might be handy as a PR move.
If I could comment about fund balance, and I think I said this last year, I don't know if everybody here is the same people, but your fund balance doesn't even have to be a percentage. It can be a flat number. And, you know, if we have a major emergency that we need to take care of, and that's gonna cost, we estimate, you know, up to $500,000, you can put a hard number as your fund balance, because your budgets are kind of, you know what I mean? You get a lot of grant money and then you don't get any, and then you get a lot and you don't. So that fund balance percentage kind of changes based on how much you have in expenditure that year. So, you know, you might consider establishing a hard number as a fund balance, and then you don't have to worry about it, you know, going up and down depending on how much expenditure you have in your budget. The county also has some funds where we just have a minimum fund balance of, you know, $1 million, not suggesting that's what you need, but what does a large-scale emergency in the county look like? What does that cost? You know, maybe it's more than $300,000. I don't know.
Probably not, but it just depends on what it is. I mean, we had, you know, the big norovirus outbreak, we've had TB situations, we've had, you know, things like that, but, you know, I mean,
What was it for like Lincoln's Challenge? That outbreak?
It was Nora, that was Nora.
But
yeah, I don't remember
do you
what
think
the amount
dollars
was,
were?
but I know that there was no money put up for it, so, we won't talk about that one.
Well, and the only other thing just about your budget that I think you should be aware of is that we've had really healthy property tax growth. We've had, you know, CPI at 5% for a couple of years, which we've never seen before. And new growth revenue for the county has been pretty astronomical the last couple of years. This particular year for 2024, though, that new AAV added to the tax rolls for the county portion was half of what we've seen it. So of the 6.25% levy growth, 5% was related to CPI, and the rest of that was associated with new growth revenue. But I will tell you that the Board of Health CUPHD levy split, if you look on page 2, whereas in 2021 and 2022, Board of Health kind of was growing a little bit more and CUPHD, EAB was decreasing a little bit. In 2023, that flipped. So Board of Health went down and CUPHD went up. This budget is prepared with the expectation that that split is level, but I don't know what it's gonna look like. You won't know what it's gonna look like until next April.
Is that because of annexation, or is that because of development?
I don't know the ins and outs of, you know, the county clerk provides those numbers, so I can't tell you what drove that. But I guess what I want to say just in general is that, you know, the strong growth that we've seen in the property tax levy over the last few years is going to probably go down in the next few years.
Thanks, Tammy, that's something definitely to consider in terms of its impact on future fund balance growth. Other questions for Tammy?
I don't know whether this is a Tammy or Julie question, but so obviously the grant revenue's gone down, but it's even gone down from what you had budgeted in 2023 by nearly 25%. What's that decrease in grant revenue? So I'm looking at what's it?
COVID money.
COVID grants.
Yeah.
Even going from 409 to 306? So I know when it was actual 1.2 million, that was COVID money, but
Well, there were a lot of little allied grants with it too, like an immunization grant and other little grants that were supporting COVID after the initial one ran out.
okay.
So it's probably those.
So
We would say that's what it
vaccination,
is, yeah,
almost all the
vaccination
decrease
grant
is COVID
and, yeah.
or related COVID.
It's
grants.
related somehow.
There's not
And-
another big grant that is gone
no.
away.
No,
The only
not
grant
that-
that we have now is workforce development,
Yeah,
but there's very little of it in this budget. Once it gets approved, we don't have approval yet, but once it gets approved, it's actually gonna be in FY 23 this year. So you're not seeing much of it.
yeah.
Okay.
And it's all, yeah, the workforce development grant is all about bonuses, I guess, is one way to call them, but it's about, I don't know. It's about retention and things like that and keep, you know.
And that revenue will come in 2023, not in 2024.
I think we budgeted 50,000 of it in 2024, but 350,000 of it was expected to come in 2023. And I think maybe I mentioned to you, we haven't done a budget amendment for that yet. I don't think we're gonna need one, just because you had some other grants that, you know, didn't come in. So, but that's something to just keep on the radar.
Where are we with pension liability? That was a
Good.
big one at one point.
Good. We IMRF,
Well, CUPHD, I don't, we
It's-
have our own.
we're the employees are CUPHD employees. So it's taken out of that, and so it's, the IMRF is good. I don't know what,
Yeah, I mean,
we keep up on that. We've made several huge payments to it over the years.
we're gonna
Huge
be making
payments.
another big payment this year too.
Yeah, we keep that thing paid up. We keep the building updated and we keep that taken care of and, yeah. Cause yeah, there was a scary year, I think it was around after 2008.
Yeah, there was a point at which that was a big issue.
It was 2009, it was a big deal because of the economy or whatever in 2008. But after that, we've been making, every single time we can, we make a big payment, sometimes mid-year, so we've got them. It's good. And I don't think that draws down on you guys so much, does it?
It doesn't go on there.
Yeah, it doesn't go on there. It
Well,
did,
wait, but 10% of it maybe.
Yeah.
Because of the staffing levels, right?
yeah. Now during veto, you might have been paying it all, I don't know.
Well,
Maybe
yeah,
that's
maybe
what
I'm thinking back about that time, yeah. I mean,
You might have been paying all of Brian, Marta.
he wanted to get rid of us, so he put up a budget so we couldn't afford him.
Two other little questions. One of them is, so if we looked at grant revenue and looked at 2021, let's say, it would be more like the 300,000. Is that right? We're sort of back at pre-COVID levels?
Yeah.
And the pre-COVID levels before COVID would have been like up around 300,000? Yeah, how could you remember? I just wondered if you knew of any other factor that was affecting it. You think it's all COVID, the decrease in grant revenue?
I mean, my memory is everything was pretty much COVID related.
Okay. And then is the miscellaneous revenue, I think you said, Tammy, 11,500 is interest from the fund balance. And so why is that less in 2024?
2024 is a conservative number.
Okay.
We don't
There's
know.
nothing
I don't know what
set.
interest
Okay,
rates
it's
are
just
gonna
being
do.
conservative, and there's nothing that you know
Yeah.
that's happening that would affect it. Okay.
Well, and I think also too, the other was being based on a 500,000 fund balance as opposed to a 340,000 fund balance. And when your fund balance goes down, then the amount of interest you're gonna make off of that money is going to go down as well.
Yeah.
Yeah, it's $200.
Okay, thank you.
Any other questions? Our next presenter is Whitney to talk about the sexual health education program.
Okay, am I allowed to give a handout? Okay, thanks. Now that we've talked about money, let's talk about something
Now
more
we're gonna
fun.
spend it, right?
Yeah, we're gonna spend it on sex ed, woohoo!
Full color, who cares for that?
Yeah.
It's UPHD, yes. Do you want one? Do you care? You can share one. Okay, so this is basically the same exact proposal as last year for 2023. We're gonna be in the same schools. So that is Heritage, Ludlow, J.W. Ader Junior High School in Rantoul, Fisher Junior Senior High, and Thomasboro Grade School. Most of the money is staffing. We have a trained health educator too that goes out to all the schools and does comprehensive sexual health education. We have a curriculum we use called Making Proud Choices. It's evidence-based, age-appropriate, medically accurate. We use it in the Champaign-Urbana middle schools. We're in all of the Champaign-Urbana middle schools in the 8th grade classes. So this would just be an extension of that program. A lot of the budget is also mileage because it does kind of take a little bit to get out to those schools. So mileage is a big chunk, and then just regular classroom materials that they might need, markers, poster board, things to facilitate the activities within the curriculum. Let's see. I know last year tracking was a question, so we do have a specific cost center for this, so staff know to charge their time in UKG to the 1355 cost code, print to the 1355 cost code, so everything's kind of contained within its own bubble, which we like. And since this budget is on a calendar year, it would start in January. So like we're currently gonna go into a couple schools this fall with the 2020 calendar year 2023 money that we have. But we'd like to be able to carry that over into the spring of 24 and the fall of 24, if that makes sense. The nice thing about this program is that in 2023 when we got the funding, we were able to get back into J.W. Ader Junior High School in Rantoul. We weren't able to get in there with our CUPHD funding because they did not meet the criteria of that grant of 40% minority, I believe it was. And the other schools Thomasboro and Ludlow all feed into the same high school. So with these additional schools, Thomasboro, Ludlow, Rantoul, Ader, they all feed into the same high school. So ideally all those kids in 8th grade will be getting the same sexual health education, feeding into the high school together. And they'll be getting the same stuff that all the 8th grade students in Champaign-Urbana are getting. And that's the spiel. Yes.
Just two quick questions. One, I know what you're asking for the budget for this year, is that right? Was that 30?
Yes.
What did you spend last year?
We're in the middle of it,
Mhm.
so I don't
Okay.
know. I don't know off the top of my head. I know in like the second semester last school year, we saw about half the students we wanted to see.
Right.
So we're gonna go back and see the other half kind of in this fall semester.
And because the students have a choice whether or not they attend or not, that's why you say you saw less, or just?
So the ones, it's a different school year, so we would have saw last year's freshmen or 8th graders,
Mhm.
and then summer happened, so now we're seeing new students. It's like,
If you don't do fall, spring, you're only seeing them
Only see
half
that.
the time.
because since it's a calendar year, it goes on a different,
Oh,
it's going over 2 school years,
does
that make sense?
Gotcha.
right? Yeah.
All right, so you feel like you're getting all the students, and then?
Yes, definitely.
Yeah, so, does the school budget anything for this kind of, have we ever asked the schools to contribute to this kind of thing?
No.
Well, yes, but it's been a long time ago.
Okay.
Yeah, we did back,
Yeah,
When
before my
Jennifer-
time.
yeah, when Jennifer,
It's
Yeah.
nice for us to be able to come in because if the teacher for some reason isn't comfortable teaching the topic, we're kind of a neutral third party for the students. They don't have to see, their social
Well,
studies
I
teacher
get that, I'm
also,
saying
yeah.
from the funding aspect of
Yeah.
not that they're doing it, since if the,
Is this a state mandate to do this?
Technically, yes, but if you're, so the mandate is if you're going to teach sex education, it has to be comprehensive, medically accurate, all of those
So they
things,
do
but
that.
you don't have to teach it, yeah.
Oh, you don't
yeah.
have?
You don't
So
have to
that-
teach
So
it.
that's what happened. They don't teach it.
Yeah.
So.
Yes.
And the point of that is so that they don't get a bunch of crap education in there like they used to have, which was just, a bunch of nonsense to try to scare the kids, which we all know does not work. But, so it was, crap, and it was getting in all over the place. They still do it in other states, but Illinois luckily put a stop to that, because that was really wasting a lot of money.
So the 30,000 from last year is carrying over till December, and at this point, we don't know where you're at and how much of that 30 has been spent. If there's any that's left over, does that revert back then to
It'll
the
stay
county
on
board of
balance.
health?
Yeah, it goes,
At the last time I looked at it, she had not spent, I wanna say, did I, 12,000? So, I mean, if I'm right, but with
Don't-
12,000.
don't let her know
half
that.
of it.
yeah, it'll just be back in your budget.
so this is budget amount, you may not spend it all in that calendar year, you
I
may
think it's
need to
possible.
roll over one way you. Say again?
I think it's possible that they won't spend it all.
Good.
Mhm.
But I also thought that, maybe you were gonna see more at that time, but if you're saying 50% of it was done.
Yes.
I would say they're not gonna spend it all.
All right.
I'd say there's probably gonna be 5,000 or 6,000 left, be my guess.
Fair enough.
We had this discussion when you first came up with this, the first time through, so this is gonna be a recurring budget request.
Sure is.
We need to look at it and then, like,
Because we're right, I agree with that, because we're taking it out of the fund balance, as
Right.
if it's not an emergency, but as if it's just come up in an emergency, and I think it does raise the question, should it be part of our regular budget, or are there other, we should be asking, are there other sources of funding for it as well?
Yeah, and I think that's a legitimate thing, is to talk to the schools and say,
Yeah.
and that was kind of the idea, is once you're in there and you show how well it works,
Yeah.
that you can then go back with the data and say, hey, we've been doing this X amount of years, this is what it costs, the county has paid for this, now would you put in half, and kind of then wean it off of that, so that they'll do it. We don't want them just to stop it. So, but to go in and say, this is how it worked, these are what the evaluations look like, you know,
Yeah.
at some point, hopefully, this is how your, you know, pregnancy rate
If we
went
said
down.
do 25% this year,
Yeah,
getting some of the money so
Some of
we
the
can
money.
get, you know, it ought to be a, you know, some kind of formula or whatever, but
yeah,
it's always better when everyone has money in,
mhm,
so they're more invested to sort of continue on.
yeah.
Because
and-
if we get a big swing, then suddenly the program stops because there's no
Right.
other source of funding, we're not going for grants, you know, those types of things. So I think we ought to look at some different ways to sort of fund it. And maybe that the schools ought to have a budget for this. They may have chosen not to spend it, but they ought to have a budget for it.
I think looking at this, most of the schools and the per capita and the property value assessments in these particular areas,
Yeah.
I think we would find that
What-
it would be pretty low.
Yeah, these are,
Rural.
especially, you know, Ludlow.
Yeah.
And Ludlow just always needs help, always. I don't think that's gonna change unless you have some big development coming up there we don't know about. No, okay. But it just is, it struggles. I mean, we've been going there for long before there was any money for it, because they just have very low resources.
Yeah, and these are the kids that you want
Yeah.
to connect with.
Yeah.
So, but yeah, if there was a way to maybe get the schools to, with potential funds that they had to, you know, kind of contribute a little bit, I don't think that.
Something.
Yeah, I don't think that would
Maybe
be
we can
bad.
put that, maybe we can put that by May or something, or April, go in and say, hey, you know,
This is, yeah.
here's the, or maybe you want to do it before the next year, but to say, you know, this is what's been put in, this is how many kids we saw, this is here's the evaluations,
Yeah.
here's I don't think we'll necessarily have any change in rates yet. We might.
Change in knowledge, but maybe not
Change in
rates.
knowledge, but we may actually, because, you know, we can look at STD stuff and we can look at,
Sure.
The reason we don't include, I don't know if everybody knows this, but we don't include these schools in our, the grant that we have for sex ed, is because that grant requires the school that we go into to be at least 40% minority. And so most of these don't meet that.
There we go.
Some of them are getting closer.
There we go.
Wait,
Is there
I-
any other additional
it's a
grants?
state, it's a state
We've
grant.
looked, we just haven't had any.
Yeah,
We
and
haven't seen any or applied for any.
It's
besides what
a
we have.
state grant, and they do that because there's just limited amount of money, so they're trying to prioritize it to the, really essentially the bigger schools is what they're doing. They're trying to prioritize it to the bigger
There was
schools.
a lot.
American Community Foundation, I'm sorry.
Oh, that's okay. There was a lobbying push for more funds specifically towards sex ed, and I think some of that was to be tagged towards rural as well, so it's not impossible that there might be a different funnel of grant money that targets rural instead, and that would be a really great thing.
Yes.
Yeah.
Because I think, you know, the targeted goals on that one are, they make sense for what they were trying to do with it, but, you know, again, like we said, like, these are also kids that, you know, are very important. Having parents who came through Rossville Outlet schools in Vermillion County, and lots of, I did not. I was a Navy kid, but my parents were both graduates of Rossville Outlet, and I'm a prom night cautionary tale. I was conceived on senior prom, so if this program had existed, perhaps you wouldn't have to deal with me.
I grew up in Hoops.
It's it is, and they don't have anything over there still.
Right,
I mean, they don't.
Yeah, that's,
I just don't understand it, I
well,
mean.
yeah, we understand it, but it's just what it is, right? So it's just what it is, you understand it. You-
I
you told us-
understand it,
Understand it, so
but-
we understand it, so we'll just. We've had this conversation before, when you were talking about the distribution charge of COVID
Mhm.
and how they matched up with other charges and stuff, so
Yeah.
some of that is just,
Some of it is-
historically, that's just, so we're at, okay.
But I found kind of, I think, on what you're saying, if this is gonna be a recurring expense, I think it should be in our budget. And based on the conversation we just had about the fund balance and where we voted to have it be 35% of expenditures, whether or not that's where we want to be, we're not gonna be there with
Yeah.
this. And if we're gonna do it every year, I don't think it should come out of the fund balance. I think we gotta either put it in the budget or look for other sources of revenue, or I don't wanna say not do it, because I think it's a really valuable thing to do.
And we need to be, I think if we're part of it, it's gonna be a better program.
Well, and, you know, I mean, you can see the numbers, you can't do that this year, you'd be over.
Actually,
Right.
yeah, no,
Yeah.
actually, yeah.
So,
We can't
yeah, that'd
solve
be
it
something,
today,
yeah,
but we
might be something
definitely,
to look at.
it needs to be something we think about and you all think creatively about new ways to engage others in funding, helping fund this worthy cause.
Go call Ginger and tell her we want the section to be a UI extension program.
There you go. Why not?
Try it.
I did freaking dog grooming, that was stupid.
No.
This would be useful.
Okay.
All right.
Thanks.
Thanks.
And we bring muffins.
Okay, we heard from Smile Healthies, you all remember the last meeting, for both of their requests, and, as you recall, we did vote to put it on the budget. So I want to be very clear that when we had our discussions, we knew we were going to be debating some things today, so we did vote, to put those both on the budget, but not necessarily, we have not voted on the budget. So if we want to go back and revisit those things, we are able to go back and revisit them if we so choose. Okay, so at the last meeting, we voted to put on the budget $50,000 for recruitment when Smile Healthy did their presentation.
Okay.
And we voted to put $50,000 in the budget for the services.
Okay.
So they're in the budget. But if you want to change the budget now, you can vote on the budget itself with those included or not. So you can still make a change if you so
Before it goes to
choose.
the county.
Before it goes to the county.
And that's different from the 50,000 for
No, those are the two things we talked about. So the 50,000, yeah, the 50,000 is for the recruitment, and then the 50,000 for services. So they have two separate
Right,
line items.
right, right, right.
Yeah.
And one's in the fund balance and one is not.
They're both in the fund, they both come out of the fund balance.
Okay,
Yeah.
all right, so when you say in the budget, I thought you meant outside of the fund.
Oh, no, I'm
balance.
so sorry.
I got it.
Yeah,
Okay.
no, they both come out of the fund balance.
Yeah, okay.
Yeah, well, that, I mean, and that does lead into, you know, in terms of services, I think we've been committed to funding services at some level, for a long time, at one point a higher level. The recruitment issue is another one, I think. I mean, does that need to be a recurring expense?
Yeah, so it's what is that phrase uses, catch 22? Because you need the services, but you gotta have the people to provide the services. If you don't spend to get the people, then you can't have the services, and so you're sort of stuck with that. So we have, you have had, I wanna say at least a year, maybe 2 years of this program, of the recruitment.
I believe so. I'm newer this year, but I believe so, yes.
Okay, so if, we may have asked this once before, but if we were to say, and maybe you can answer that, what is the return on investment? If I was at the board, I would say, hey, what, you've invested in this recruitment, what's your return on investment?
I do not know that, I'm sorry.
See, that's the question.
Yeah, and I can
right?
ask
Because
that,
if we're gonna
yeah.
say, we spent $50,000 twice, and it's resulted in us getting 4 new dentists to the area, or hygienists or whatever, that we wouldn't have gotten, then that's a pretty good return on investment. If you've said you spent this amount and you got 1, then probably it's not a good return on investment, and you may want to consider lowering that amount or lowering your expectations, because you're just not going to be able to recruit people to this area, you know, unless they really want to come to this area.
Well, I think also that when we ask the question is that there there's a 2-year commitment on
Yes.
these hires.
Yes.
Often, and you'll have to correct me if I'm wrong on this, but a lot of these are training grants, at least the dentists, training grant folks who are getting their loans forgiven or reduced for working in an impact area. And so I might be wrong about that, but that's always been my thought, that some of the folks that are coming in here are working off loans on a federal
Some
program.
of them, yes, they are. That is correct. I don't know if all of our dentists are doing that, though.
No, we don't know. So
Yeah.
it would be good to know, you know, basically that we've spent some money, we've invested some effort towards this, and we just, you know, if we can get some kind of summary of it here, what is it you know, maybe we're building momentum, and now, you know, word gets out, and we're able to get more people in. We just need to hear from you all. It's not either good or bad, we just.
And it's, sorry, I didn't know I was gonna be here until like 4:30.
No,
So I apologize about that, I was like, oh, okay, I'm not really.
You know, it like, you know.
Yeah, and
make
it's
something
yeah.
good.
correct?
Yes.
If you wanna come, I mean, I just wanted to introduce what we had done before, and then we'll give you an opportunity, like we did with Whitney, for whatever you would like to present about those two budget items, or, you know, then for anyone to ask any additional questions. But certainly we'll give you the opportunity for anything you would like to present as well. Yes. Yes.
That's all I can add. Tammy and I are both thinking that the last year's budget was only like 25,000. It wasn't 50,000.
It was.
That's correct, yeah,
Yeah.
that's correct. For the
Okay.
recruitment, it was, because we had made a decision in our conversations to reduce the amount because we weren't doing both the dental hygienist and the providers, which this last one that they presented was for both.
Gotcha.
Yeah.
Yeah,
As I recall.
the recruitment there too is, you know, we're getting another office on Kirby up too, so we need more providers. I think now we have, with the 3 clinics there, we have 16 operatories, so we need to fill those more with, you know, recruitment obviously there too. And then as far as the other money for the services there, we are gonna start seeing, well, we see the Head Start program, but we only did like, I believe last year, and again, I wasn't here there, but I think we saw like 6 clinics or something, and we're trying to implement like 1 per month there, so we can see kids if they're not able to come in the clinics, at least they can be out in the schools. And then we're gonna start doing the dental sealant program. We're kind of talking with Illinois, sorry. Who was I talking to today? From the Illinois Health Services there, we were kind of asking questions on how to get started on that, but we do hope to get like 6 schools there to outside of, you know, the ones that you guys see in Champaign-Urbana for more of the sealant school program, so we can help more of those kids outside of Champaign-Urbana too. But yeah, it's just kind of growing bigger. So.
Right now, what is your staffing requirement? What are you trying to hire? How many?
We would like to hire 3 providers, whether that be dental hygienists or doctors. If I had to take a guess there, I'd rather have 2 dentists and then 1 hygienist for recruitment to help in those extra operatories and out in the schools. Yeah.
How many do you have right now?
We have 3 dentists and 2 hygienists right now.
That's more than you used to have.
Yes.
By 1.
Yeah, we, Dr. Song just started in March, I believe, and then Ashton is another hygienist that started in May, the end of May, so fairly new.
And at the last presentation, it was stated that the funds from last year had resulted in hiring of 3 dentists. That there were 2 that are already here and another one was coming in, as I recall. Is there still another one that's coming beyond those 3 that you just mentioned, or?
Yes, Dr. Syed, he will be here. Credentialing is taking a little bit longer. We're hoping that he comes in mid-September. Again, kind of waiting on all the credentialing to be finalized, but he did sign papers and stuff, so he will be. But he is, and then there's another one, Dr. Elgindi, he will be full-time as well too.
So
Again, I don't know the,
So that would take you up to 5 then?
yes.
5 dentists?
But would that, so would that be the additional 2 that we're looking for? You have 3 now, you said you were kind of hoping to get 2 more dentists and 1 hygienist. Would those 2 dentists be the 2 additional dentists?
Only, I believe only 1 would be that. The other 3 would be for the Kirby office that'll be opening up, and then 1 more for Francis Nelson, because we just added on 6 more operatories. They're not all finished yet, so that's kind of
And my
waiting on other things, but yes.
They will be seeing both city and county individuals, or primarily city, or do you know the breakdown of that?
I do not know the breakdown of that, I'm sorry.
Yeah, Does this, if we can, does this grant, would this work the same way as the sex education? Do you just provide the money and you, or does some of it come back if you don't use it? And do we pay for the expenses like we do with the sex education program, or do we just give Smile Healthy with that money?
Of course, no good administrator ever leaves anything on the table.
It's not a drawdown.
It's
So
not a
I
drawdown.
believe Administrative Services is processing the payment for the Smile Healthy, the $50,000 for the Smile Healthy services, and then on top of that, the portion related to this recruitment.
Right, so they were paid and we didn't get anything back, and I know, Tammy and I communicated into the payments because they were going out, but it was based on the budget that was presented by Lisa when she was last with us. So we had a breakdown when we met the last time of what they would use those expenses on, and some of that was moving and on the equipment piece, and some of that was the incentives, the bonuses, and those types of things, and advertising.
But you went over that it would all be spent.
Right, yeah, with the notion that it would all be spent.
I do have that information though.
Oh, you
The
do?
breakdown.
Okay, she's got it, I'm so sorry.
For the recruitment costs and sign-on bonuses for the 3 dental practitioners is $13.50, which is a portion of that. Recruitment costs, interview, travel, that's $13.5, and then recruitment costs, advertising, et cetera, that is $23,000 for it to break down at $50,000.
So 13,500 for
Yes.
those two pieces, and then 23 for, yeah.
You know what, I guess since we're participating very heavily in this program, that it would be interesting to take a look at the overall budget in terms of, Medicaid reimbursement and all that, just to get an idea how big this program is financially and physically. At some point, not tonight, obviously, but it'd be interesting to take a look at the budget, both city and county, because they're commingled, clearly.
Scratch.
Go ahead, I'm sorry.
From a budget perspective, I can see that healthy recruitment is the transfer from the fund balance. Where do I see the services under?
So the services, we get those updates from Smile Healthy. So in your packet, it tells you how many children they're seeing in the county. So from the service perspective, we're tracking each month when they give us their breakdown of how many children and in what locations they've seen them, and that tells us how they're spending the
I
money.
just mean, where do we see it in the budget?
Oh, in the budget. So
So
in the budget, we pay them. We just get their report back, and then we transfer the funds to them. Tammy does, she sends them those payments.
Right, but would that be an expense item then for us?
It is, it's in your first column, the one to the right of the yellow.
Yeah,
Pardon, it's where?
this first column.
Under, it's above
I
total
see it under
contractual.
total revenue, the line item.
Yeah, but that's the transfer from the fund balance, that's 50,000.
There's another 50,000 that is above total contractual. You see the total contractual of 100.
Where it says Smile Health.
Yes.
No, I don't see it, I thought I did, but I don't. I see the Smile Health recruitment for dentists, 50,000.
It's 6 lines above total contractual of $152,094. If you see that, go up
Right.
from,
I see that, it's Smile Health recruitment for dentists.
oh, I'm sorry, then there's another Smile Healthy at the bottom. I thought you were seeing that red has Smile
Okay,
Healthy.
no, I wasn't seeing that one.
Okay.
Okay.
Thanks.
So that really the recruitment is not coming out of one of them coming out of fund balance and one of them isn't.
The recruitment is coming out of fund balance.
Okay, and the other one is not.
Is that right?
Is it, it
I thought
doesn't
it
look
was.
that
No,
way.
it is. It just-
Yeah, it is.
Because I
It's still
can't-
coming out of fund balance, right?
No,
Recruitment is coming out of fund balance, Smile Healthy is in the budget. I think it's flipped on your chart, right? You've got Smile Healthy. You've got Smile Healthy at the bottom, but that's always there.
Yeah,
What's
yeah.
new is the recruitment. That Smile Healthy has always been funded.
But if you see at the top, you'll see that I have property taxes offsetting majority of the 50,000. So that, where they provide services, the majority of that is being covered by property taxes. So it's included in the budget. Where the
What's
recruitment
included
is
in the,
not.
say it again, what's
50,000.
included in the budget, the 50,000 for services?
Is that the thing, separate contracts, not CUPHD? Is that the one you're referring to? Okay, so that's the down one, so that's up at the top.
So that's why you say it's from the budget, because it's from the tax revenues.
Right.
And then the
Right.
recruitment is the 50.
So it's
that you're asking-
50,000 that we are not spending for our contract.
Gotcha, and then 50,000 from the
Fund balance.
fund balance for the recruitment aspects of it.
Yeah.
Is that what you got? All right.
Any other questions for Hillary?
Same question that Peterson asked before. Would we anticipate that this 50,000 for recruitment would be an ongoing expense that you'd be asking us for?
Oh, I wish I was more prepared, I'm so sorry. I think you'll be at the end of this. I would say if everything's fully staffed, I wouldn't think that would be an ongoing expense there.
You might get fully staffed in that meeting.
That would be great, yes.
You might not get fully staffed, but you might get staffed enough that you don't need 50,000. for
No,
recruitment.
no,
I
I would
have
step in.
I have a question though.
Yes.
So if the contract every 2 years, so every 2 years, the term is up, is that you still need that $50,000 for recruit?
For recruitment?
Yeah.
Again,
years from now?
I would hope not, just because if we're fully funded, we wouldn't need to recruit anything.
Okay, so just to follow the question, just take one second. So I'm a dentist from somewhere, and you recruited me here. You gave me a signing bonus to sign a 2-year contract. At the end of 2 years, I'm ready to go back to wherever, or I can stay here. But in order for me to stay here, I gotta sign another contract. Are you gonna give me a bonus again to be here? Is that the only way you're gonna be able to keep me here? I'm just at,
Just to throw it out there.
Yeah, that would be a good question to ask. I will
Right.
ask
Well,
that.
you've got the same thing with doctors in these
Yeah.
situations. If, you know, part of it is they're here because they're paying off a loan,
right,
they're gonna generally go private sector.
right. Gotcha.
Well, another thing was because they want to establish, they hone their skill. So maybe that this will be the stepping stone for them to build their speed.
For sure,
No,
but at some point, your contract is over.
Right, 2
And so-
years, right?
Yes,
Yes.
2 years.
2
So
years.
after, so you don't have the data yet. So part of what we're talking about, the return on investment, it's like we're saying we're gonna, we're giving you some money in the past, but if we're doing it, we just need to know how, as you think about the program, how successful is the program, and how are you thinking about funding it long term? If there's a potential for more turnover of your doctors after their contract is over, right? Or your vet techs, and so now you're back to square one where you need to get more people in, or you need to convince them to stay on by giving them a bonus or not bonus or raise, whatever, I don't know.
Okay.
Okay?
What is the percentage of cost of living go up? Would you include that into the new salary, you call it, or stipend to the doctor that want to stay? Because a lot of people might not want to leave when they got, used to the environment, but still, money and still issues.
It's not just, it's all over, right? So there's, at the university, a lot of folks come in and you get their initial training, you get them all trained up, and people are snatching them away as soon as you get them trained up. Right? So it's something that they're having to deal with too. Okay, do we give them a raise? Do we give them a signing bonus? Do we give them, how do we promote them so they can stay here? We've done sort of the groundwork of getting these folks prepared to move on to the next step, but we'd like them really to stay in, at least in the area. I don't know.
Of course, one of the detriments for this particular location is that there is no dental school here. So often you could recruit folks into faculty, and we don't have that. In terms of medicine, we do have that option.
Right.
But I was going to ask Julie, do you have these same problems with recruitment in your staff?
I don't think so. We have 2 long-term dentists and we have part-time dentists right now.
So why do you have less trouble?
Well, I'd like to think it's me, Dr. Peterson.
Well, we know that's not
Okay,
true.
well, let's go on to you, and you can run those programs too.
No, I don't know. I mean, I think that we have certain things here that attract people. We just have certain hours. You know, a lot of times dentists they have to run their own office and all that kind of stuff. So they don't have to do any of that here. They don't have to mess with the billing. They don't have to. They just come here and
They don't have to
you know,
supervise staff.
do the dent. Yeah, they don't have supervised staff. So I mean, we have a lot of things that built in. It took us, decades to get here, but
Okay.
yeah, we've had our dentists have been here a long time.
Over 10 years, probably.
Yeah.
Is the money bigger in public health than it is in Francis Nelson?
I don't know. I doubt it. I mean, I'm sure
I know hygiene isn't.
hygiene is, and the thing is now, there's the new expanded license hygienist. Wendy, you could probably describe that better than me, but basically, jump in here if I need to.
Public health dental hygienists, they can do more without the direct supervision of a doctor, like a doctor on site. So that's
And and they have those too.
Yeah.
Because you can have it
Yeah.
at public health and at
QHCs.
Impact areas,
Yep.
Yeah.
federally qualified.
Would they have to be seen by a doctor 6 months prior to, for them to come in 6 months later for checkup,
Gotcha.
things like that?
Yeah. Yeah, it requires some, scheduling to make sure that you're making maximum use of the hygienist. But we have certain kinds of hours, we have a lot of flexibility.
And your staff is on salary?
They're on salary and they're here, they're all full-time, and,
They qualify for public service loan forgiveness too.
yeah, that's a big one, and
Okay, yeah.
so do they. I mean, that's the really big draw. You have all those dental
Yeah, it's a
school loans.
significant amount of money.
Yeah, it is.
Yeah.
It is, and so when you're working at either FQHC or a public health department, then you definitely are gonna get that. I don't know if it works. I think it has to be, I don't know. I mean, you can't just go anywhere. You can't just go work in a dental office and get that. It has to be like, public health or FQHC or an area, like go and set up and be a dentist in an area that has no dentist. Like, everything south of I-70, sick leave. So,
Are there any other questions for Hillary?
No.
Thank you, everyone.
Good job.
So, thank you, Francis. Last presentation, and then we can consider everything, is the senior needs assessment.
So the senior needs assessment is what we talked about a little bit about last time. We know that we're about 300 beds short in our market, whereas in the state overall, there's an excess in most counties of 17%. So not only do we have a shortage, but most of our nursing homes are rated 1-star. May or may not be a good indicator of the quality of care. But there are certain needs that are not being met. Patients are being sent out here. So we now have the support of both Carl and OSF to put together a community collaborative to have a news conference on the 29th announcing that public health got money from the county board to do the needs assessment. But we're really going to have to work hard to find an owner and operator for additional skilled nursing beds here in our community.
And you said that it's not necessarily going to be the county, the
I
former
think
county
it would not
facility.
necessarily, I mean, that'll emerge as the collaborative works together. I mean, we just talked with a group, this company out of, I'm trying to do it quickly, out of Bloomington Normal that just sold their 23 beds. They've been in the business for 50 years and they just got out of the business of owning, operating for-profit beds We went and talked with the CEO, and he said it's not a viable business anymore as a for-profit. He said, we're gonna continue to manage homes, but we're only gonna manage not-for-profit homes. It's the only way to provide quality care in a nursing home. And he said, you really need additional sources of revenue, which we think might be possible. Both Carl and OSF have said they would look, need the services so much that they might consider financially helping, but they can only do that as a not-for-profit. So really what we're looking for is, we've got public health who will do a needs assessment, and from Heritage and others tell us that we also need a consultant or a market study done that really says quantifiably, here are the number of beds you need, here's the number of Medicaid, here's the number of behavioral health, here's the number of high-cost medication beds, some specialty addressing. And I think that's where we're gonna need about $20,000 possibly for either the consultant or the outside expert to come in and do a market study in addition to the needs assessment. And I don't know for sure. I think the collaborative will come together and say, here's what else we think we need. And we'll have the first meeting of the collaborative on August 29th.
So the county is kicking in?
So the county's kicking in 30,000, and what we understood from the conversation is that they are going to be paying, that the needs assessment seems to already been done, that we know kind of what the issues are, but that's going to be going more towards the market study end of things, and that consultant that you're talking about, or
No, that was the 20. We said, I just had checked with her and Steve Summers and Kyle to make sure that everybody was on the same page. You saw my emails back and forth to make sure that you wanted us to do a needs assessment.
Right, but it would be.
Because we can't do the we can't do the how to make a fabulous nursing home consulting.
what will the needs assessment cost?
Well, originally what we put in was 50,000. That came from the last one we did from Rob and Zahida. They put that together. They said, can we do it for 30,000? And I think we can. A needs assessment is like anything. It's like how huge do you want it to be.
Would you do that in-house then?
Yeah, we'll do it. Yeah, we will do it, and then put the report and everything together. We'll get the data that's out there, but we'll also go talk to people and collect some original, primary source stuff.
And Robert Davies put together a proposal, and
Yeah.
that's what was to do
Yeah,
the needs assessment. So that would be a new one. And the county committed to 30,000, and I think there's some discussion has to go on as to can you
But
do
we
it for
don't need
30,000?
20,000 more. I thought that's what you were asking me earlier.
Yeah, that's what I was trying to clarify.
No, we don't, for that part, no. This is for, I guess,
This is for
the
the
other part.
additional expertise that we think we need.
So we're not at that point yet.
We are probably not at this point yet. We think we might be in like 2 months, but we're not at that point yet,
Okay, so
right?
there's a potential that we're there. Yeah, so.
I don't know how long, because,
Yeah.
the needs assessment, they gave us an estimate of like 6 months.
Right, I think we might do the market study at the same time that we're doing the
Oh,
needs assessment.
I see, okay.
So when I talk with Carl and OSF, they're sort of saying, okay, if you're gonna, we really need to know how big this is gonna be. It's gonna be 150 beds, it's gonna be 50 beds, it's preliminary to say that until we've done the needs assessment, but that's one of the reasons they want the market study, because I see the needs assessment getting more of the clinical and the services, and
Yeah,
the
and
market study
finding out
getting
what,
to the numbers.
what families want and things like
Right,
that.
that's
because-
right.
And
What providers
we know
need.
we know a lot of stuff anecdotally. We don't have it like down. We know that we don't have beds for people that are morbidly obese. So, we don't have any rehab beds, to my knowledge. That was one of the things we learned. We know that we don't have it. A lot of, what is it called? I need a nurse here to help me out, but like acute care, or it's something.
Oh, right,
Yeah,
right.
acute care nursing home beds. We just don't.
No, we don't have that.
Somebody discharged from the hospital with pneumonia who is not over it yet.
Right.
Or,
those are
and a
one
lot of the rehab too doesn't exist.
Right.
And it doesn't,
Right.
and if you are discharged and you're morbidly obese, there's nothing.
Yeah,
Um,
there are
because that
places
was-
who say, oh, we can't handle it, but there aren't rights. And when we talk with the hospitals, they're saying, and when we look at the literature, they're saying that what's evolving in nursing homes is specialty care. So they take a patient, like you just said, with pneumonia, pneumonia and they get discharged, but they maybe still need high-cost infusion of antibiotics at a nursing home, and Medicare won't pay for that.
Well, another common category that I'm aware of is also ventilator dependent.
Exactly, that's another one that's, and that used to be, a pretty common, kind of thing, but now you're talking about shipping somebody to Indianapolis or Chicago, which is.
And they're even shipping them to Indianapolis for high-cost medical treatment, like chemotherapy drugs that they don't get paid for in a nursing home. So I think it's unclear for what we, clearly, we don't know what we're gonna come up with yet until we get both of those done. But I see the market study as being more quantifiable and the needs assessment as getting at topics and services and clinical issues.
So let me just on this, when you say a market study, are you talking about identifying providers who would be providing this care or this bed?
When they come in and do a market study, I just looked at a sample, they come in and look at the demographics and look at what the demographics would indicate would be the need for nursing home beds. And then they look specifically at illnesses in the population that are likely to need. So they do a calculation based off of demographics, and then they also do a competitor study. So they go around and talk to all the quote competitors, other nursing homes and probably assisted living facilities to, if they don't talk to them, they get the information about them. So you can say, here's how many beds you need, here's what's being provided now, and so here's what we ultimately think you're gonna need based on what the need is and what's already being provided.
Hospitals would weigh in on that.
Oh, big time. The hospitals are gonna drive much of this, honestly. Hospitals, and to some extent assisted living, because the assisted living are also having to place people and not able to place them.
Is that
And lots of people are off, we have a group of behavioral, was one of the things Carl identified, behavioral disorders, not just dementia, but really behavioral disorders, and people are getting kicked out of nursing homes because of that, and then no place to go.
Yeah, well, that's a big problem.
Yeah, it's a big
Mental
issue.
health aspects is tremendous problems.
Right, and there are other communities that are solving this problem. I'm not quite sure why it's so bad in our community, but.
I'd venture a guess, but.
Well, it is. Anyway. So I think this is, I mean, of course, I'm in the age group, but I think this is a significant problem for our community. And it's not just me saying that. When I sat down with the CEO of OSF, he said, we're losing $3 million a year on patients that we have to keep in the hospital who should be discharged to long-term care facilities.
Oh, okay, well, there's a funding source.
That's right.
That's precisely
That's
right, because
that's
it's
right.
both hospitals.
That's right.
I didn't hear a number.
If it's $3 million in OSF, you figure it's probably at least 10 times that at Carl. And that's why they're both saying, yeah, we'll consider how we might be able to help with this financially, because just what you said.
Yeah.
If they've got $3 million losses, they could reduce that.
And being in the prevention world, it would have been lovely for that to have materialized while the county still owned the nursing home.
Yes.
But that's not how things work here.
Mike wasn't on the county board at that time, was he?
Nope, that's why I ran.
Yeah, and that's exactly the kind of, that would have been the best way, because when you have, I beat this dead horse, but when you have a place like the county nursing home, which was pretty amazing.
At one time
it was absolutely amazing, and it could have been again. And there was no, and you have to do the braided funding, which is what, they're saying. It would be the not-for-profit, then you could still have the fundraising arm, and then the hospitals, or the county, the county's already involved, but, or the cities, or whatever, different places would have to put in. But if they were gonna accept, people from other counties, then you get them to chip in as well. I mean, it's gotta be, it would have been a perfect opportunity for braided funding.
And our county still assesses us for nursing home. So we passed the tax in 2002. That assessment continues. It doesn't go towards a nursing home anymore, although I think it does go towards some of the losses, loans from the county. But soon that will be used up, but the assessment continues. So that's another possible source of funding. But when I talk to somebody like Heritage, who's run these for 50 years, they say that's the only way you're going to have a good nursing home.
Yeah, it is a good model,
right?
Especially if people look at it as a community asset, which is what it County Nursing Home truly is.
And our group has looked now at what are the not-for-profits. Carl was willing to give us the information about where they place all of their patients and which ones are for-profit, which ones are not-for-profit. And there are a number of not-for-profits in Carl's market area that they're using. So some of them are community-based, some of them are government-based, some of them are religious-based, but there's some opportunity to do that. We just have to figure out.
Carl has not had any interest in getting into that business
Carl
himself.
has expressly gotten out of that business. I was working for Jim Leonard when he said to me, I never want you to bring that up again. So I was afraid he wouldn't talk to me about it this time. He said, we got the need, we just got to figure out another way to do it.
It's a braided funding issue, that's what it is.
It is,
That's what
right.
it is.
Okay,
And so what we're looking for is funding to help us get to the solution.
potentially,
Yes, this would not be ongoing funding.
for sure,
Right.
one time, okay, got it.
With Carl and OSF's help, as you indicated, and, the expenditures that they're incurring through, various points in their systems, was there a request for them to kick in some of the money for the market study, or are they interested in providing some of that?
They might. What I want to ask Carl and OSF for is ongoing revenue source funding. So I don't want them to get off the hook with $5,000 or $10,000. I think we're looking at saying to them, OSF could lose $3 million a year. How about supporting this to $1 million a year? You're still better off if we can get all those patients out of your hospitals. So they might fund it. I mean, I could go back and ask them. And actually, the county said they might have some additional funds, but I'd like to hold on to Carl and OSF for a much bigger request.
Okay, I just wanted to clarify, because I heard that comment from you earlier, so I just wanted to
Yeah,
clarify.
yeah.
And I do think we're in a little bit of a more of a hopeful place right now, because it does seem to me, and I've been saying this, since I started, because that's what public health is the, prevention aspect of it and the social determinants of health. And for the first time ever, it seems like they are kind of starting to understand what we've been talking about. It's like they're getting that if you have money in housing, then you have less people in your ERs. If you put money into, hopefully they'll see this, you put money into taking care of people, in a nice place like what a nursing home could be, then you have less wasted time in the hospital where they're just languishing and shouldn't be there. They won't be spending all the time trying to, social workers won't be going wild trying to place people all over. And that's a hardship to the families too, and that's what's something we need to capture that in the needs assessment. We need to capture some of those stories because it's heartbreaking.
It is.
I mean, when you have a kid and you have to ship them to Indianapolis and they're in a nursing home, I can't even imagine what that's like. You'd have to.
And if you're getting them in a facility that really can't manage them, you're the hospital, you get them right back.
You get them right back.
And if you get them right back, they're not getting paid.
And when you
for
get them
having
right
that
back, you get dinged really hard
Right,
by
you don't
Medicare.
get paid, right.
Yep.
Okay,
So.
Any other questions for Kathy? Okay. So just to clarify on your agenda items, it's actually a request instead of a needs assessment for a market study.
No, yes, I'm sorry, yes, it is.
So as we move forward, that takes us to line item 4 for approval of the budget. So we've heard all the presentations. We've heard the discussion regarding the fund balance. So I'll open it up to discussion on each of these items, kind of taking them all, as one. If we would approve, it would be a total of $115,000. So if you're looking at page 2 of your Board of Health Special Revenue Fund, $15,000 is what we have traditionally done for the emergency services. $30,000 is what the request is for sexual health education in the county. $50,000 was the request for recruitment expenditures from Smile Healthy. $20,000 the request for the market study for senior. For the senior. That's a total of $115,000 from the fund balance. So that's where you see your change from the $455,824 to the $340,824, and that is 26% of the fund balance. Yet we still need to add in the 54,000 potential dollars in taxes that we will have to pay back based on the latest judgment on Carl 2, and that would take our fund balance to 21,000 if we funded all of those. So I'm just kind of recapping everything.
21%.
21%, yes, I'm sorry, did I say that wrong? My apologies. So if we want to enter into discussion about any of these that you for sure want to fund, that you're concerned about funding, you know, I'll open it up to the group for any discussion on any of those items that we just heard presentations from and discussed.
Well, I guess I will just open up. If, you know, do we think we should be funding the recruitment at the full $50,000 level, or should we do what we did last year and go to 25? Or do we look at it as this year we'll fund it at that level, but not next year?
Yeah, I think we need, what we'll need is to, you know, to have the group come back and talk about what the plan is, you know, more long-term. It's fine if we say we're gonna provide funds to recruit somebody in, but when the contract is over, if we're looking for every 2 years, put another $50,000 in, or every year it becomes, we won't be able to keep this budget up much by then.
No.
Yeah, because there's not gonna be a good return on investment, right? So we're probably going out, but not enough product coming in. So maybe it's just an assessment on, you know.
So what's your thought on the number?
For this budget year.
Leave it at 50 this year, or?
We talked about it as a group pretty thoroughly last time. I think we should stick with that, since that's what we talked about.
Yeah.
Not everybody's here now. We talked in much detail and got the report. I just think we need some additional forecasting as it were moving forward. So I'm okay with the budget now, year and year.
Okay.
Same thing from my view on the sex education part, to go ahead and fund it, but to really have the whole team really look at and explore other options for providing additional funding. As Julie just mentioned, to some kind of funding. What kind of, would you say the funding?
Braided funding,
Braided,
it's just,
yeah.
where you can
Yes.
pull in, you don't
So
require
for
one.
these types of issues, we can do the same thing, find other sources of funding, so that everyone is just not depending on, you know, the county board and how taxes go up and down, but more people as a community see this as an issue and be willing to invest, you know, time, resources.
Well, I'm not sure I can speak to this since I'm kind of got a request in, but I think the
You
possibility.
can, it's not gonna benefit you personally.
No, okay. I think the possibility of doing it at the 25,000 is something worth considering, just frankly, because even though I want, asking for money, I'm worried about us getting to the potentially 21% of when we all wanted to be higher than that. So I think that's a reasonable question at least to ask. I would kind of support doing it at $25,000 level.
Yeah, so we already voted that we want to keep it at 35. We're clearly making, if we say we're gonna, if you fund any amount of it, you're below 35 already. If we said, no, we're not gonna do anything, you stay at 35, otherwise you're below it. So it's just one of those, it's sort of like, okay, well, next year we can't approve anything, right? Based on what, if we get down to 21, but the next year, do not ask for anything additional, because we won't be able to fund it, right? Because we've been too far below it. So
The nursing home needs assessment will not come next year,
No.
but the recruitment line item
Sure.
may, and the sex ed item
For sure.
may.
For sure. So that's
Yeah.
at least $80,000, almost $100,000, that if every year you do it, all the numbers do is gonna go down, right? Because otherwise you just say, hey, do you want it this year or do you want it next year? Are you sure you got your people? Are you sure you want to spend the money? Because we're not, next year it's like, okay, the answer is no. We can't spend any money because we're gonna be too far below.
Could we take a look at the dental recruitment? We're not talking about, the dental services are part of our budget, so we're not talking about that. The recruitment, I mean, could we put it on a, we guarantee, we put 50 in, but 25 of it depends on an assessment mid-year.
So I thought a great deal about this, and, you know, I was one of the biggest proponents of Smile Healthy getting money from the start. I don't know, Julie, was that 15, 17 years ago? I don't know when we started all doing all this. And we have consistently provided support to them for dental services that directly impact, you know, individuals in the county. And my concern is with the recruitment, you know, $23,000, if I remember correctly, that is just advertising. And then there was another, you know, 13,000, I believe, that's housing expenses and, you know, some additional like moving expenses and things. And then, you know, bonuses. I mean, yes, that helps bring in providers, which is why we gave that money last time. And with 25,000, you've recruited 3 individuals. So you've upped the numbers from 2 to 5 with the 25,000 that we gave last year, but you're asking for 50 more, but you only need 1 more based on the numbers that you gave us previously. So to me, that seems counterintuitive if you're, you know, apply here, sorry. If you have 25,000 and that, you know, recruits 3 and then you want 50 to recruit 1, I know that dental hygienists also need to be recruited. I'm just, you know, looking at the provider numbers. So I'm also concerned, you know, about how much is coming from, you know, the fund balance and, you know, what we have previously discussed and, you know, those going down. And I also see, you know, we have some of these other, you know, things. So we are not, you know, certainly not funding dental services in the county because we still have committed $50,000 to that with Smile Healthy. But I am concerned about the $50,000 for recruitment, and I don't know if that's something, you know, we can continue to do or if that's something we want to do, you know, this year. And I have had conversations with both Mandy and Julie about, as I, you know, started the very conversation this evening about, you know, that fund balance. And if we keep, you know, drawing down, you're absolutely correct. We're gonna, you know, we're gonna be in a, because we're not, you know, if only 11,000 is going in every year and you're taking 111,000 or 115,000 out,
You're done.
you know, it's, you know, that is a concern. So I'll just, you know, put that out there. That's
Kind of interesting that this discussion is about 2 years ago, we were looking for ways to spend it.
And, yeah, and that is, of course, what happens, but that's why I'm happy that you have the, you know, percentage for a fund balance. But the other thing is, though, too, remember that I don't think they really get much back from our contract ever, because that's like the 12 payments, but you will get some back probably this year from like Whitney's program, because that is based on how many, you know, she sees, so
There's a drawdown.
some of that will go back in there.
Right.
But that's not a ton.
Is it just one more that you're trying to recruit as far as dentists go? I thought I understood that. Well, I thought I was hearing, and there are hygienists that I know that you're looking for, but you're adding more operatories, it sounded like, than even we had initially, than what I remember discussing. So is it really truly one more dentist and a couple of hygienists that you're trying to recruit with this money?
I'm so sorry. I wish I would have came a little more prepared. Like, again, she had to go to their other meeting there. But, I mean, as of right now, we have the 2 that are coming on. 1 more I know they at least need, and I don't know if that's for this year or if it was for the following year. But if we have 16 operatories, 3 dentists, and 2 hygienists aren't going to fill those by any means. But, yeah.
So in theory, the addition of the operatories, I mean, you would like to have those all
yeah, and
work.
each dentist has like 2 chairs.
Right.
Obviously, a hygienist has 1. So.
But if you don't have the hygienist, you don't have the dentist, you can't open those chairs anyway.
Correct.
Can't use them efficiently.
You can't, I mean,
Yeah.
like, let's say we got this is a big operating room right here, but we don't have the doctors and the staff for it, well, you don't open the operating room, you got that. So just so we're clear, so when you said you have 2 that are coming, and so those are the ones who already benefited from the 25K that we gave you last time? Or is this, or do you anticipate this?
And is that funding, is that this year, correct?
I don't know, this request is coming for fiscal year?
Yeah, so this will be the next fiscal year. So the last one was the 25 that you said you have the 3 coming in. And, you know, to clarify, Mike, too, I was looking at county you know, because some of those operatories that were being discussed are, you know, in the city, and that was a question I asked previously, so those would be primarily benefiting people in Champaign-Urbana and not outside the county, and we've always tried to be, you know, very careful and direct in making sure that our expenditures affect those individuals in the county, it's not, you know. So I would say, you know, CUPHD at this time, that Board of Health, as I understand it, has not put any money in on any of these recruitments, and I would think, you know, that was something I was gonna mention too, is perhaps going to them, you know, because we've kicked in so much so far, perhaps going to them and saying, you know, can they kick in $25,000 out of their budget to help with some of those recruitment, you know, and then they're, you know, bringing in people as well. I mean, it's another, you know, possibility, because we've kicked it in for the county, and so, you know, that's brought 3 in, and maybe they can do the same to bring another 3, you know, and so, you know, certainly, as I said back in the beginning, I recognize that the services are in need.
Yeah, well, and I don't know how the subdivision of that always happens in terms of where the people are placed versus who they're seeing, right? Because, I mean, there are, to my understanding, people in Francis Nelson, that would go to Francis Nelson, can come from anywhere in the county, but whether
in the world.
Right, and they're not necessarily, like, so where we place, because my wife did Francis Nelson a day a week for like the first 4 years she was a dentist, and did a lot of those mobile clinics, and then stuff at the, you know, at the building and at whatever it was at the time, Urbana. And so, like, you know, and the need was like inexhaustible, right? And so I just am trying to figure out, I guess, for me, how we can best help them fill as many of those operatories as possible, because it will be a general lift to the entire county. But yeah, I mean, if there's a way to talk to people from the PhD board about maybe kicking in some money.
I saw Julie kind of ducking her head under the table while the discussion was going
I just assumed she was texting me that she remembered.
Oh, no, I was not, no. You're talking about us putting money into Francis Nelson?
Into this.
The county,
the
that this,
Recruitment?
board, yeah, CUPHD board.
I doubt it. I doubt it. I mean, because we, you know, we do that. We have our own dental program, but we, trust me, it costs a lot to subsidize that, so.
Well,
how much of it do you subsidize, how much of it do you get from Medicaid?
We get a lot from Medicaid. Mandy can tell you, it's certainly been getting better, and you know, that was the big thing, is to expand it, we had to do Medicaid, and you have to, there's certain things you have to do, and one of it is to have the chairs full all the time. What is, you know, I don't.
We bring in about $1 million a year.
$1 million a year.
$1 million a year for Medicaid, so.
And what's the program cost?
I don't know, I know we used to subsidize it with about.
Yeah.
No, it's not, it's getting better, but I don't know, I didn't come prepared for that.
Yeah, well, and I don't want to put you on the spot, but that's why with the Francis Nelson thing, I'd like to see
The whole budget,
an idea of what the budget would be, what the activity was.
Yeah,
We're
because,
definitely still paying into it using our property taxes.
You are still subsidizing.
yeah, definitely, but not like.
Not much.
Not like you were.
No. It's almost flipped from what it used to be as far as what we run in billing compared to what we, put into it. It's almost flipped, so it's much better.
Laura, can you give us those numbers again? It was 23,000 in advertising. Sorry, I tried to read that down. I have too many to read here, sorry. That's okay. I'm so sorry.
No, that's what
I'm like,
it was,
where's-
13,500.
oh, here it is. It was in there.
23.
So recruitment costs, you know, sign-on bonuses for the 3 practitioners there would be $13,500. And it did look like, I'm sorry, that for the January 1st through December 31st of 2024 is for additional 3 practitioners, so sorry. Recruitment costs like interview, travel, that is $13,500 as well. And then recruitment costs, for advertising, job posting, $23,000 there.
So you said, did you say an additional 3? And so I thought, so we had talked about you have 3, and then you were potentially bringing in 2 more. And this is all for the county.
No, that's, yeah, that's, it's not,
Yeah, that's the other piece of it.
yeah.
So you're expecting a total of 8 dentists, 8 providers? Is that what you're saying?
Not 8 dentists, I would assume at least 5 dentists and then 3 hygienists. We at least need 3. We only have 2 right now.
And we were told that really it's more difficult to recruit the hygienists than it is the dentist.
I feel like it's the other way around,
You
but
do?
that's me personally.
Okay.
Yeah, we have a lot of hygienists that apply there, but we really only just need 1. There's more, you know, on Indeed that we use there, there's more hygiene that respond than dentists.
Yeah, you know, this is like a fairly high level discussion, and we're maybe a bit short on facts.
Well, you can you do the budget one way or the other, either with it in or with it out, and then go, Tammy's gone, but
Well, I was sort of asking
And
that
then
actually earlier.
ask them for the information that you want on the whole program and how many's there, what are they billing, Medicaid, what are they getting, insurance, what are they getting, these services. But the thing that this group needs to make sure to focus on is that, because you know, we do all the, theoretically, we do all the kids in Champaign-Urbana, right? It's the kids
Outside.
outside of, and the adults, because we do not have the adult program, we never have. So, well, with the exception of one time with the, like, HIV carve-out thing, but,
And that's what we're trying to make sure is covered, but even I know from being on the board of Francis Nelson, as you would expect, there's a huge percentage of it that isn't within the city even so. I mean, so we're
but if it's kids, that's, you know, potential duplication services, but
Right.
probably not, because I don't, what is our caseload right now, I don't even know. I don't remember what it is. What?
I don't know.
Yeah, I don't know. We can get that look at. I mean, that's the key, is to not fund something that you're already, that's already being funded by the district. So make sure that it either goes to, because, you know, you can tell by zip code or whatever, address where the kids are, so as long as the money's, you know, going into that, because that would be all the kids outside of there, but there is a lot, I can tell you, there is a lot of confusion and a lot of irritation all the time when people come in here for WIC, for example, and they don't understand why they can't get dental services here. Let's say they're from Rantoul or anywhere around here. Even like the outskirts of Urbana, which is actually the county, you know, they don't understand that. It is confusing.
So if we said, put back to then, so if we wanted to wait and put this on hold to get more information, and then we move forward the other, is there time to come back to this and add it later before?
Yeah, I think you want to, if we do that, I think in terms of administrative protocol, is that we would fund at the 50 level, but hold 25 based on assessment.
You can't go back and increase it.
Yeah, you can't go up the other way without county
No.
board.
No.
Yeah.
So,
There's not a second swipe at it, it's just.
Yeah,
now's the
if the
time.
presentation's next week, we need to present it as we want it to be, and then again, if we want to say that we're comfortable to vote to fund 25 for now with the idea that we will budget 50 just in case we get the information that we want, sure. But in terms of what we're going to sit through at the budget hearings next week, the county board,
Gotcha.
we need it.
Yeah, I think we want to be accurate.
You do not want to do a budget amendment.
Right, no.
That's exactly it, yeah.
And thank you, Dr. Rizzo.
So I was gonna say, you don't want to do that.
So that 25,000, I mean, if we approve 25,000 in the budget, and we get more information, say, boy, we really think we do need to do 50,000, that's just taking more out of the fund balance, and we would have the opportunity to do that, right?
That would still be,
No?
Yeah,
Yeah,
if we're going down that path, we need to put 50 in and then
Okay.
yeah,
make the 25, half of that contingent on
yeah. And,
assessment.
you know, certainly, you know, we're all a group. Is there anything you want to say, Dr.?
I agree with that. I think we could delay a little bit much, so I agree with you. We put in 50, but spend 25 and the other 25 with contingency as needed.
Do I need to make some kind of a motion on that?
We don't have a motion at all to table it.
Yeah, yeah, we
Okay.
don't.
Just had conversations.
I don't know if you know, we might put that on 50, but that's my personal. Then you need to say that.
I did. I wouldn't be funding 50, I'd be funding, oh, maybe I didn't hear you, I'd
Yeah.
be funding 25.
Yeah, I mean, I would,
Out of the box, you'd say 25.
I would just, yeah, because that's what we funded last year, and last year that brought us in 3. So like I said, I'm not wanting to completely, you know, not be supportive. I just, you know, based on what we were able to, what those funds were able to be best utilized for last year, it did result in the 3, and there was one more that you said you needed for Francis Nelson, and that was the one in the county that I was thinking about, and those, because I was, you know, writing down all the information you were giving us and adding up those numbers. You know, we want to make sure that we're being specific to, you know, the county too, so, you know, without all the back and forth and budget amendment potentially or any other things, you know, I was just thinking of funding at the 25.
At the 25,
Yeah.
okay. So I'll move 25.
But again, I'm not, you know,
Well, I mean,
Happy to
I
say
think we're
I
getting
don't
the
wanna-
sentiment here.
yeah.
Yeah, we're talking this through, and I had forgotten, frankly, we only funded 25 last year. I had 50 in my mind somewhere.
So are you saying you would move approving the budget with that change to it?
Yes, I'll move that the line item for improvement be 25,000.
But but if you said you're just moving, changing that line item, you're not saying approving the budget?
No, just moving, changing that line.
Yeah.
The budget is, well,
With
we have not even moved the budget
We
yet.
have to approve the budget. Right.
You still have to vote on the other side.
But
Yeah.
even with that, we still need the assessment piece to get information back,
Right.
to get a sense of
Yeah.
how this thing's gonna play out. Again, with the passage of this budget and with the anticipated tax stuff, we're gonna be back down to 21%, when you said we want to be at 35. And I think you're all thinking clearly when you said we want to go at 35, so if we suddenly, in 1 year's time, we're at 21, I'm not seeing what we're gonna fund next year at all.
Yeah, that was my concern, you know, as well, we were having previous.
I don't think we're gonna
conversations.
be back up to 20, to
You know,
35.
but maybe that's okay, you've done that before,
Yeah.
and you built the fund balance back up, and when it got too high, then you were able to fund some extra
Right.
projects.
You know, I think it would also, you know, so that Smile Healthy can plan appropriately, you know, perhaps appropriate to say this, if that's what you're feeling, that this would be the last time we would provide any funds for, you know, that particular, you know, line item, because, you know, we've had the 50,000 in our budget, you know, for quite some time.
We're not
you know,
talking
providing
about, we're
service.
not talking
We're not
about
talking
changing
about
it.
that,
No.
yes, absolutely not. So, yeah, I mean, just so that they could plan
Yeah,
appropriately.
we've got to have some other funding source, otherwise you're not gonna have anything for your emergency at all.
Of course, I'd pie in the sky to ask the dental society.
Yeah,
kick
pretty
in.
much.
Yeah.
Yeah, pretty much, yes.
Physicians and lawyers do, but
Okay, we have a motion for 25,000 to fund the Smile Healthy recruitment. So I am on your agenda under G for discussion of proposed budget items. We're looking at the Smile Healthy to assist in the recruitment of dentists amount of 50. So the motion is to alter that amount to 25. Is there a second?
Second.
I'm not sure
Thank
if
you.
you said it fast. Linden? And moved and seconded discussion. Any concerns with that change?
Just the assessment fees, we just dive into it.
So, and we'd like to hear more about how the funds are being utilized. Okay, I think
we're now pretty major partners in this.
Thank
You
you.
know, how we got money.
All those in favor?
Aye.
Anyone opposed? Any abstentions? Okay, so that takes care of that one. Then I'm going back up to the top. So Smile Healthy budget request for the Child Dental Access Program. This is already in our budget. We just need to go down and make sure we, approve all these, and then we can finally approve the budget. So each one of these we need to take a look at. So is there?
Move approval of that 50,000.
Thank you. Approval of the 50,000 for Smile Healthy for dental services, seconded by Mike.
We can probably do the other two as well, can't we?
Any discussion?
We can do them as
on
an
that?
omnibus if somebody wants, right?
Okay, we can do that.
Yeah. So, yeah, the 50 for the services, Smile Healthy Services, the 30 for sex education. Well, the 15 is, that's been there before, so that as well. So, and we're looking at the senior needs at 20, so I'll move all those lines.
Okay, Dr. Peterson has moved all of the discussion and approval budget items for the dental access program, the emergency services, sexual health education, Champaign County, and the senior market study.
Second.
And recruitment, just at the lower number that we've already changed, right?
Yes, yes, thank you. I'm sorry, you seconded that? Okay, my apologies. Moved and seconded. Any discussion? All those in favor?
Aye.
Anyone opposed or any abstentions? Thank you, guys. Now, all of that is done. Now we'll go to the approval of the actual budget. So you have the budget in front of you. I'll entertain a motion to approve the budget.
So moved.
Second.
Okay, moved by Dr. Peterson, second by Linden. Any discussion of the budget? Anyone want to look at anything personnel-wise or any other line items that we have not previously discussed? Hearing none? All those in favor? Aye. Anyone opposed? Any abstentions? The budget is approved. Smile Healthy report. So we have report for June 2023 in your packet. Also the invoices and administrative services of the program. So that's that payout that we're talking about. So thank you for clarifying that, Kathy. So those are included there. We can entertain approval of both of those if you would like. Thank you, Mike. Motion, do I have a second?
Second.
Second by Kathy. Any discussion? Hearing none, all those in favor? Aye. Anyone opposed or any abstentions? Okay, I'm under I, CUPHD invoices. We have invoices for both May and June. I would entertain a motion to do all of those together if you would like.
Yes.
So Lyndon has moved. Do I have a second?
Second.
Okay. Second, Dr. Hick. Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. Champaign County contracts. So if you recall, we learned at the last meeting, Tammy notified us that anytime there's any grant that comes through now or a sub-grant, we have to approve those. So we will see these possibly on the agenda every meeting or at least every other meeting. Some of these, we just have to approve those expenditures. It has to be in writing. Mandy, is there anything you wanted to add to that? Did I say that accurately for you? Okay. So we have the TD Education Screening to Ukrainian Refugees Grant, the NCPI, and I'm not for sure those initials. Does anybody know?
NCFI.
Oh, did I not read that correctly? I'm so sorry. I don't have my glasses on.
Yeah.
NCFI. Maybe that's why I didn't know what NCPI meant.
I mean, either. Yeah.
For public health emergency preparedness for $62,726, and then the Champaign County grant application for strengthening Illinois public administration. Is that workforce one you were referring to?
That's the workforce.
That's the workforce one. Okay. So, I would move all of those, and then if anybody wants to discuss them individually, we could also do that.
Move all.
Okay. Lyndon has moved
Consideration.
approval of those. A second? Second by Mike. Any discussion? Any questions about these? Anybody wants to ask?
I had a real hard time figuring what they were for
In the
in the
legal
packet, yes.
Yeah. Yeah, they're putting the actual grants in, right? Yeah, I know, it's a pain in the butt to read through all that, but usually it's within the first 2 pages, anything you need to know, but not always.
Not always, yeah.
Not always, sometimes it's in the end, but basically, one's an emergency preparedness grant, one is, literally money for, that one's self-explanatory, TB education and screening to Ukrainian refugees, and then the other one is workforce development grant. That's the SIPA one.
Do we have any Ukrainian refugees in
We do.
Champaign County?
Mhm.
We do.
Yeah, we do a lot of, but I'm trying to think what they call them. I think they call them refugee screenings. So we do a lot of those. And, you know, the refugee centers in our building, so we work really closely with them. And there is money for that, shockingly, so.
We have providers on campus too.
But it's not just, we do it for others. This is just real specific for the Ukrainian refugees. I don't know.
It's just a grant, you apply for a grant from a.
Yeah, it's not usually, we don't usually get them like for a real specific, that specific, but whatever, it goes in the pot.
Because of the war, probably, this came.
Yeah, and so we only get to use that money specifically for Ukrainian refugees. Nobody else, but,
Okay, moved and seconded. Any further discussion? Hearing none, all those in favor?
Aye.
Aye.
Anyone opposed or any abstentions? Thank you. Our last 2 items there, Form 5, CPHD reportable diseases and performance management. I'd entertain a motion to place those on file.
So
I moved.
Second?
Yeah, but they have to ask a question on, so when I look through this report, so, how are the reported cases of Hep C and Hep B sent to you? Are you picking those up yourself, or are they coming from the hospital?
they come from, they come in as a reportable disease. But, like, I know that I get faxes all the time about Hep C and B, all the time. And then those are kind of split up into where they go and who works on them. You know, because the Hep C, we're trying to get people treated, and so, but they come in just like a
Or
regular.
are they coming, is Hep C coming out of methadone clinics? Does it come
No, it mostly comes out of the, I think most of them come out of the labs.
out of the lab?
Mhm.
Oh, okay.
So when somebody goes, we get a lot of stuff from blood centers too. What they do though is screen, so, you know, then we have to go back a lot of times to retest, because they're just doing a screening test, and people freak out, whether it's HIV or syphilis or whatever, and we have to go in and then actually retest, do the confirmatories and find out what it is, like syphilis, for example, do you really have it, or is it an old case, you know how syphilis is.
Yeah, I found it, the Hep C, it is not uncommon for me to come up with.
Oh, yeah.
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 Hep B, acute Hep B is, in my 25 years, has been rare.
Well, and I don't know that it's even acute, that's the whole thing, is because we get them reported all the time from labs. And it could just be as if, you know, you've had it. You know, it doesn't mean that you have it right now. That's all those have to be
And then
investigated.
they go back and take a look at an antigen study, see if it's active.
Yeah, so if you are testing, what lab do you use to test?
We're going out of town, so drug scan, we
Yeah,
do a
so-
reference lab.
Yeah,
Yeah.
so they usually, I don't know, I mean, I don't necessarily see anything specifically from that lab, but I wouldn't necessarily, I don't get them all. I randomly get them, I don't know why, but,
It really
we
falls
usually-
on us, I think, to report them, actually.
does it?
Yeah, I think it does.
That's interesting, I don't know, because we do get, I mean,
If you,
I
if
can
you
tell
run
you-
across them, you definitely are on the hook to report, yes, sir.
Yeah, so.
Yeah,
All
because
right.
it's sent, you know, to Philadelphia, and then, you know,
Yeah,
it's on you, Doc.
So do I need to call Candy tonight and let her know that you'll be sending over a box? Maybe, I mean, you're not reporting them?
So the portable machines, you gotta
We-
go.
And basically, the majority of C has been reported through the primary care physician.
Okay.
Yeah.
And then they'll hopefully, getting hooked up with tests, but we get all of them.
But B, I mean, I've, acute B, I've seen like once. I mean, if I were in Southeast Asia, it'd be a different story.
Exactly, and the thing with B too, of course, is there's vaccination now, so we don't see it like we used to.
Yeah.
I mean, it used to be, we didn't see that quite a bit. But yeah, we've got a lot of Hep B vaccinations out over the years, so.
Judy, with the immigrants coming through the United States abundant, have anybody report about a TB?
Everybody gets screened, so yeah, I mean, occasionally we'll get cases, but sometimes it's not like active cases, it's just that they test.
Exposed.
Mhm. And it depends on, that TB, that's a whole nother mess, because a lot of countries do the BCG.
BCG vaccination.
And so that forever, so we can't use, we have to use quantiferin gold for those tests and all that. So it's, a lot of times they might be screened out somewhere and then they end up with us and it's not even a TB case. So everyone has to be looked at. But we try to use the quantiferin gold. It saves us money and time in the long run, because you don't have to go do, if it's just a vaccination.
No, that's a standard practice now anyway, isn't it? The VA was using
I
quantiferin
wouldn't
gold.
know.
instead of
I wouldn't know what standard
Yeah.
practice other places, but we've been doing it here for a long time because it just became too much of a pain to do the skin test, because then you have to send people for chest x-rays. And a lot of times they couldn't get those, so it was kind of a nightmare. So,
Thanks, Mandy.
yeah, but I don't, our TB has been relatively steady, for a while, so. If we catch any, it's, we treat it and then it's done, so. But for the most part.
You had a year ago or so, you had somebody had to monitor because he was not very reliable.
Yeah, well, occasionally we get those, but we still do directly observed therapy, but yes. And I think that we're even doing directly observed therapy some with people who have latent infection, just so that it doesn't, move over. But it's been, not that I don't jinx me, but it's been pretty good. We haven't had those problems that we had with people just not doing. Basically, isolation was the issue.
We have a motion on the table, it's been moved and seconded. Any further discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? I did put on here old business because I didn't know if you'd have anything else to add, or if anybody else had anything else to add on the long-term bed situation. I know we did a lot of discussion previously. Is there anything else?
No, I did one quick comment. We're getting a lot of support and it's moving ahead, so I think really appreciate the, thoughts to keep us moving ahead.
Absolutely. Public participation on non-agenda items. I think
Pretty safe on that one.
our public has left. So the next meeting, so this is the one we had added on there. I will be at the American Public Health Association conference in Atlanta, and usually some of the CPHE staff are typically there as well. I know the 21st is when we would have typically met in our rotation.
We moved it, yeah.
We moved it because of Thanksgiving that week. And then APHA set its dates. So
We'll move it a week earlier then? the
so I
7th?
don't know, is the 7th?
7th is election day for reference.
Oh, that
Oh.
is, thank you. Thank you so much.
I mean,
Why is election day not on my calendar?
well, it's election day, I
But
don't
it's not national.
we probably won't have anything on there, but just FYI, that's
Yeah, it is election day. Yeah,
it's
that's a
just
good point.
notably election days. Next year will be the bigger one, but,
Yeah,
But if anybody's doing.
Is there anything that comes up?
I don't think we're gonna have any like referendum or anything like that on there, but it's always worth noting, that's definitely the box that.
Yeah, I don't wanna keep it anything vote.
Yeah.
How about the 28th?
When is Thanksgiving?
The
23rd.
23rd?
Yeah.
It's Thursday before?
That's the after, the Tuesday after.
The Tuesday after. After Thanksgiving, okay, no problem.
I don't know the schedule, the 21st would be better for me.
The week of Thanksgiving? I mean, I'm not opposed to that, I'm working all day, but I could be here in the evening.
No,
Mr. Chairman.
I actually don't have a problem either, actually, with it. We just had avoided that just because.
We just avoided it because it was Thanksgiving.
Yeah, we didn't have any conflicts.
I may not be able to
Yeah.
make it either way, but we can just, whatever makes sense.
We've got a county board meeting that night, so I'd be leaving to go to that, but,
Oh, would that be a problem then? We don't wanna lose you.
I mean, the only other thing I was gonna suggest is if we were looking at the 14th, but we can't do it, when are you gone that whole week?
Yeah, I don't get back to the 15th.
Okay.
I get back on the 15th.
I was gonna say the 16th, but I don't know what it is.
Oh, okay.
I don't know what it is, Thursdays are like.
It's a different day. Are you guys good on a different day of the week?
Yeah.
That's a great suggestion.
I prefer Thursdays, actually.
Well, gee, it's a win-win. All right, yeah, I fly back in on the 15th. So, yeah, I'm looking at my calendar, 16th looks good.
I'll take a look at it, may not be able to make it, but if we have to put it on.
Okay. So we're gonna move to Thursday, the 16th at 5 still? Everybody good still?
Yeah.
Brent should be back from Paris by then.
You're going to Paris?
No, Brent is in Paris right now.
Oh, Brent is, I thought you said, I'm gonna go to Paris.
No, he'll be back by then.
Well, no wonder he's here. Well, I guess he's got a good excuse. He better bring us back some like beignets or something, although I guess by November they probably won't taste very well.
Of course.
All right, I just need a motion to adjourn, you guys.
So moved.
Moved by Mike, do I have a second?
Second.
Second by Kathy, all those in favor?
Aye.
Any opposed, any abstentions? Well, we don't typically have 2-hour meetings, but we got a lot accomplished.
Well, budget is
Yeah,
always a good
Yeah,
thing.
the budget was.
There's every